All right, thank you for staying with the Monday Report Townhall session. We're still talking about what we're calling the silent killer because it kills 8 million people annually. That is an estimate, could be higher. That is the use of tobacco. And we're being told by the experts that there's no safe form, not at all. We see some of your questions. We'll pose them to my experts in just a bit. But let me bring in a farmer now. Can you start with your name, sir, and tell us what has your experience been like as a farmer? And do we have alternatives to tobacco farming?
Okay, thanks. My name is Roberto Parr. Roberto Parr is a farmer from Risab County, Migori County. At the same time, I'm a lead farmer there, which I'm helping farmers to transform their life or to move from shift from tobacco to other crops, alternative crops to tobacco. I'm serving them as a FSC, Farmer Service Center, working with the alliance called project which is run by CGA called Farm to Market Alliance. I'm just doing it an offer since I'm a farmer or I've been a farmer who have been doing tobacco because I was born in a tobacco home. My father used to do tobacco when my eyes came to open. I just found my father doing tobacco, and he did it for almost the rest of his life to earn a living. And what made me to go against tobacco are as follows. First and foremost, we used to get hard time when it comes to going to school, because when tobacco was being cured, we were the first labor to work on tobacco.
As children?
As children. And I can remember very well, I started working in tobacco project when I was old as 6 to 7 years, when I was in class 2. So it was just the main source of income when my father or my mom could earn money to assist us in the providing bread or bring bread on the table.
And that really is where the elephant in the room is, because many people say this is our source of livelihoods. So are there alternatives for farmers?
Yes, the alternative there is, because as per now, I'm not doing tobacco anymore and I'm living well. I can speak something small which is somehow hurting me when I quote it out, that my father passed away being that he was doing tobacco and he was not taking it or smoking it anymore. This is just because that room where we used to live, that was the store where he used to keep tobacco. So every time or all the time we were there, we used to inhale that polluted air, tobacco. So I can just say that or confirm to the members that there are so many alternatives to tobacco. One, there are crops which are now being encouraged and is being promoted by World Food Program, World Health Organization, and FAO. So these alternative crops, one of them is beans, high-iron beans, which is having more advantage than tobacco. So as per now, I don't see whether tobacco will have any chance in Huriri or in Migori County, because people are transforming rapidly. They are living it. Because I can even assure the team that when this alternative crop was introduced 8 months ago, whereby we had 340-something farmers. And as per now, the second pilot is going on. We have around 1,000 farmers who are already shifted from tobacco to high-iron beans.
As you pass your microphone, let me bring in Dorcas on this. Dorcas, the in thing now is e-cigarettes or nicotine pouches. Those two, are they as dangerous or are they better off? e-cigarettes is the one thing that now young people are now using, and nicotine pouches, the one that they put under their tongue. What are the effects of those?
I will take you back a little bit and mention that tobacco products have a lot of chemicals. Like a cigarette has over 7,000 chemicals in it. And about 70 of them are cancer-causing agents. And a cigarette is not a wrap of paper and a filter. It is actually an engineered product. It is highly designed. If you look at it, the way the paper that is used to wrap the tobacco is manufactured or is designed, even the filter, how it is designed. The industry engages psychologists, scientists, and behavioral specialists to actually study how the cigarette can convey as much nicotine as possible from the behavior of smoking, and also in the form of preparing the tobacco to put it into the cigarette wrapper. And the components the ingredients that they add include those 7,000, form the 7,000 chemicals, besides the chemicals that the tobacco plant absorbs during the growing. So the traditional cigarettes, which were combustible cigarettes, were found to scientifically proven to harm people who also don't consume them through secondhand smoke. And so that's why the World Health Organization and the governments that are member states passed the Tobacco Control Convention, and Kenya ratified and put in place Tobacco Control Act to control consumption of tobacco products, cigarettes, and the smoked and unsmoked and all forms of tobacco products, because they are all harmful. When this happened, people who are smoking, many of them quit. Some did not start smoking because it's hard to buy, it's hard to smoke it, you cannot smoke it anyhowly. And so now the tobacco industry is coming up with novel products or emerging products that are trying to subvert the law.
Yeah.
Products that are not combustible, so that you cannot say that you cannot smoke it because they are not smoked, like the pouch. So they're delivering nicotine through a pouch to target the youth, because since we put the tobacco control in place, the Tobacco Control Act in place, many people now don't even know brands of cigarettes. The children of today do not know brands of cigarettes. And because it's so hard to buy, it's so hard to smoke it, now they're introducing products that they think they want to introduce products that can subvert the law. These are smokeless products.
Yeah.
So they all contain nicotine, and they are not safe.
Okay.
We have many events of people who have used electronic cigarettes and it has blown up on their faces. It irritates the lung directly, and it is very corrosive. If we had samples here, you would not sit here, because they have fumes.
Yeah.
So you can imagine inhaling it into your lungs directly. So they are not safe, and they are not alternatives to cigarettes, and they are not quit aids. They don't help people quit using tobacco products, but actually they sustain the nicotine addiction.
We are calling it a silent killer. How long does it take for the effects to kick in? And that is on two categories. One, there's the secondary exposure that you're talking about. How long will it take you to get affected? You say a member of the family is smoking, but once in a while the smoke comes to you. How long will it take you to get affected? And how long will it take the person who's primarily smoking it to get affected?
Tobacco, if used as intended by the manufacturer, will surely kill half of its users. So by selling nicotine, people consume other substances with the nicotine. The nicotine causes you to be addicted, and while you consume tobacco products, you're consuming poison, toxins, cancer-causing agents. And so they take time, because they pile up the dose and the length of consumption. But on average, it has been shown that it takes up to 20 to 25 years to get severe forms of diseases like non-communicable diseases, and also to affect the reproductive organs, the skin, the eyes, everything else. But also there is immediate effect. For example, if somebody smokes now in this room, the second-hand smoke goes into the furniture, the particulate matter settles in this room. So it starts to irritate everybody else. Everybody else inhales it.
Yeah.
And the person who is inhaling it, the active smoker actually, immediately they smoke, it takes a few seconds for it to reach the brain to give the kick that nicotine gives. And immediately also it is transmitted throughout your body in the blood, so your blood vessels start to constrict and your blood pressure starts to go up.
Yeah.
Your oxygen level go down because you are inhaling carbon monoxide and you're inhaling, you produce a lot of carbon dioxide, so your oxygen level goes down, your blood pressure goes up, and your body reacts to the effect of nicotine, where you feel excited and it triggers. That's the beginning of the addiction.
The addiction, okay.
So if it's a silent killer because it is marketed as if it's a good thing, it's a macho thing, as Robert said earlier, that he thought it was marketed to men to show that it is an in thing to do.
Yeah.
And many people, I remember seeing an advertisement of a brand of tobacco product which was showing a lady, very beautiful lady in an elegant evening dress, was attracted to a man who was smoking. So every woman would think that every man would think if you smoke, you drive a beautiful car and you get a beautiful woman. And so the women also thought a guy who smokes triggers that picture of that man.
Yeah.
So the advertisements have stopped.
Yeah.
And also many times they advertised products targeting women in the form of with information misinformation that if you smoke you lose weight or you keep slim or things like that.
Okay.
And even manufacture and design products that are colored to suit women, like in pink, colored made like lipstick.
Okay.
So it is targeting women and making women think that what a man can do, a woman can do better by marketing these products to them.
All right.
So it takes a long time, but also there are immediate effects.
Okay. Robert, I'll come to you to tell me from your book what lessons you wish people could learn, but I'm sure there are some questions from the audience. Yes, start with your name, madam, and your question or comment.
Thank you very much. My name is Elena War. I am the CEO at the International Institute for Legislative Affairs, ILA. I have a question to Madam Nancy. Now, we see a lot of use of social media and internet platforms for attracting young people particularly. That's our concern tonight. What's the ministry doing, either the Ministry of Health or in conjunction with other regulators, to see how we can regulate use of internet and social media particularly to advertise these products, particularly the e-cigs and these other new products? Thank you.
Okay, you can answer that question directly.
Yeah, thank you, Celine. The tobacco control law was signed in 2007. And after that, then there is the Constitution of Kenya. And after that, we have seen a lot of development in the internet area, and that area has grown so rapidly. So what the board and the Minister of Health is doing is to review the law so that it is in step with the current trends. Like when the law was passed through Parliament in 2007, all these things that are current were not there, including these nicotine pouches, including all these electronic devices. And so we are revising the law to include and stop all this advertising and to stop everything else that is happening in that arena. But believe you me that it is all towards catching the youth, because the youth are in the internet, in the Instagram, in WhatsApp, in whatever, in the internet. And so the manufacturer, the importer, and the seller, they want to capture the youth and exploit the addictive nature of nicotine. And so we are getting there. The law is under review, and very soon they'll be caught. Okay. And we are working very closely with the judiciary, the office of the DPP, the CID, all the KRA. We are working with all those agencies, and we have a partnership with NACADA, so that as NACADA looks at narcotics, Then we are looking at tobacco control and nicotine products control.
Okay.
And we will work together. And all those people who are exploiting that addiction, they will come to book.
Okay. All right. Next question over there. You have the microphone.
Thank you very much. My name is Dr. Catherine Amulundu. I'm a clinical psychologist and addiction treatment professional. I run a rehabilitation center called the Fountain of Hope Addiction Treatment Center in Syokimau. My comment, it's actually a comment to the Ministry of Health. What we've seen in our practice, over 90% of people who come to the rehabilitation center seeking treatment for addiction will have started whatever other drug they're using by using tobacco. But tobacco does not bring them to the rehabilitation for addiction. So they'll come to the rehabilitation to be treated for alcohol use, for cannabis use, for cat and other type of drugs. But you realize they're also using tobacco, and for them, that's not a problem. And the relatives who have brought them, that's not a problem. They'll say, if we can only stop the alcohol, the tobacco is not causing a problem. And then we have heard how long it can take, up to 25 years on average, to see the detrimental effects of using tobacco. So my comment is to the Ministry of Health, can we do more, especially on tobacco cessation programs, so that at all the Ministry of Health centers, we just screen for tobacco use. Just a simple question. Do you use tobacco? Do you smoke? Do you use tobacco in any form? And then we have a program which we can help these people stop their smoking, because we know once you've started smoking, nicotine is quite addictive, and it's not easy for someone to decide on their own that they would like to stop smoking. So I'm just putting a challenge that the ministry could do something, be more proactive in helping people to stop smoking.
All right, as you pass the microphone back there, you can make a comment on that, Dorcas, because she says that people are not so concerned about smoking. They're saying if they can just stop drinking, the smoking is not such a big deal.
Thank you very much. Before maybe I respond, I would like to clarify that all forms of advertising, promotion, and sponsorship are banned, including on the internet. So these people you see selling on Facebook, Instagram, and in their Facebook pages and any other social media, and even blatantly online, they are violating the law. And so we need to work with other agencies, including the Communications Authority and other platforms that advertise and promote tobacco consumption and products in Kenya, that is against the law. And maybe we need to strengthen, we are going to work with other agencies to strengthen the enforcement, and also to manage, to work with other governments to manage cross-border advertising.
Okay.
So to respond to the question, the government actually, Ministry of Health, has trained many nicotine cessation counselors, and also has worked and trained NACADA counselors, so that anybody who's calling for any rehabilitation or any help for rehabilitation for drug dependence is able to also provide counseling for tobacco cessation or nicotine cessation.
Okay.
But as we take your point positively, and we are going to further strengthen the cessation services, and most importantly the community awareness, so that people can know the harmfulness of tobacco products.
Okay.
In addition to that, the Tobacco Control Act does not approach one aspect. We actually cut across from the farm to the consumer, to sale, to advertising, all that, and we implement them comprehensively. And also including taxation to increase the price and to help people to quit smoking. We monitor these trends, every data of the spectrum of tobacco control. So we are not implementing parts of it, and that's why we worked even with FAO and World Food Program and WHO to support farmers while we reduce consumption and demand also.
Okay, let's come to you. Yes, start with your comment or question. Start with your name.
Thank you. My name is Wendy Birir. Currently, I'm doing a case study on tobacco, not only as a health hazard, but also as an environmental hazard. Just like you stated, the statistics has it that 90% of tobacco production is done in developing countries, and 33.5 million hectares of land are destroyed yearly due to tobacco productions. So this says that it creates a deforestation, soil erosion, and even leading to low farm yields soils that doesn't support production of other crops or even vegetation. So what is the government doing? Mostly this goes to Nancy. What is the government doing, or even the other policy makers doing majorly to see like the producers are responsible for the environment and even the economic cost of the waste product of tobaccos? What is the government or the policy makers doing? Yes.
Okay. On environment, you can answer that question directly, then we'll come back there. There's a microphone. Yes.
Okay, the theme of the World No Tobacco Day this year is about environment, that tobacco farming and tobacco use destroys environment. One of the members of the Tobacco Control Board is a director in NEMA. So the government is fully aware, and the law, the tobacco control law, even when it was crafted, was fully aware about the destruction of environment by both tobacco farming and tobacco use. Let's start from the tail end. When people smoke, they used to throw the cigarette butts everywhere. And so when it rains, you find, like in Nairobi, a whole mountain of cigarette butts in the lines, in the stormy water drainage. And so that is destruction of the environment. So we are fully aware about the damage. And like Robert has said, in farming tobacco, all the seedlings consume so much water because the seedlings are planted along the riverbed, and all those chemicals in trying to preserve the plant, that they percolate into the water. So we fully understand that the water is highly polluted. But the most dangerous one is that the curing of tobacco leaf, 1 acre of tobacco consumes like 2.5 tons of wood, which is a lot of wood. Yeah. And so we are fully aware that while the tobacco consumption brings a very big disease burden to the health of Kenyans, tobacco farming brings even a worse burden in desertification and food insecurity. So we are also working very closely with the Ministry of Environment, especially on the theme of the World No Tobacco Day, okay, to tell Kenyans that there is no good thing about tobacco, whether it is in farming or in consumption or in destroying the health of Kenyans. Yeah. For instance, everybody who had been exposed to the years of smoking, when COVID hit, those people were the hardest hit, whether they were secondary smokers or whether they were first-hand. And the doctors just found this person has gone. Yeah. Why? Because their lungs and their whole system was very badly compromised. So the government has this disease burden hanging on the shoulders because of this destruction. The final one, I want to pick from where Dorcas has left off. These new products, when inhaled, whether in the electronic device or vaping or the nicotine pouch put within the mouth, it goes straight to the brain. And we don't know the ingredients of these products. Could it be the reason why we have a rise in mental illnesses after consumption a few times of those pouches? That addictive nature, while it has brought a lot of cancers, and because we don't know the ingredients for sure, many Kenyans are affected mentally, their whole body, a lot of diseases. And so if we cut off the use of tobacco and the planting of tobacco, we will have taken Kenya to a higher level in every way.
All right, I have about 20 minutes to go. How many questions do we have in the audience? Okay, so we'll take them in threes so that we go really quick. Let's start on this line. 1, 2, 3 questions, then we get a response, and then get to the next line. Yes.
Okay, thank you so much. My name is Lillian Bevy. I am a member in the Tobacco Control Board, and I appreciate the session. Mine is not a question. I just want to make a comment.
Okay.
We have all heard about the effects of tobacco to our health, to our environment, to our pockets.
Yeah.
And it doesn't look like there is anything good about tobacco. My thinking is that we should make a lot of noise for everybody to understand the effects of tobacco,
right,
and to know that it is very dangerous to start using, especially to our young ones, and that they are not going to be rich if they continue using tobacco, because it seriously depletes our pockets. And if we have a member of a family who is taking tobacco, then it affects all of us.
Okay.
Either health-wise or even in our pockets when they get sick, we have to come back and chip in and make sure that everything goes well.
Okay.
So my prayer is that we all combine efforts,
yeah,
and make sure that we pass this information as much as possible, including the media, to help us pass the statistics, and to make sure that we tell the Kenyans that it is a very dangerous to use tobacco,
yeah,
and we are all of us getting affected.
All right, thank you. As you pass the microphone, let me hear from back there. We are taking these comments in threes. Yes, go ahead.
Yes, thank you, Trevor. My name is Sheni Julius Jesse from the Presbyterian University of East Africa. I'm a fourth year. And the statistic from the research that was done by World Health Organization, that was in 26th July, some years back, that is in 2020. As Trevor introduced it, said that about 8 million people die yearly. And among these 8 million, we have 7 million people, users of this tobacco, and around 1.2 that they are exposed on the second hand smoke. And the same research shows that around 80% of these users come from the second and lower income countries. Does it mean that poverty is maybe the leading factor to the rise of tobacco? And then two, me as a student, and the students who are here can also attest to it, that you get maybe there's a party somewhere and you're all joining, and so you find your fellow peers are there and they're asking you, Jesse, can you smoke, or do you smoke? So when your answer is no, you're like, they're like, no, man, just get out of here, because the people who are here are guys who can smoke, which means that, smoking as well provides a sense of belonging to a certain class. And you get some also students as well that they're there like, Jesse, they use the sheng. Jesse misses in your lecture, says get anything, cast just smoke. I'm on a pata, me nikinge exam room, kama just smoke, says get anything, as in says kumbuka anything. So are there any maybe measures that you've put in place in our schools or in these institutions to ensure that we are combating this issue of tobacco?
All right, let's get the third one here, and then we'll get the answers. Yes.
Thank you very much, Trevor. My name is Dr. Somba Givungu. I'm a medical doctor of 40 years experience. I do primary medical treatment, and my view of tobacco is that tobacco is poison. And throughout my years of working, I've seen cases of people coming with problems of cancers and deformities. Like now we have just shared now with Mr. Robert here, amputations, disabilities.
Yeah.
And this actually saddens me, because somebody comes at tail end of medical complications because of smoking only. And to me, I like Kenyans to know that this particular product is poison.
Okay.
And it leads to, in Kenya, for example, we know that there are about 8 million people in the world that are dying of usage of this compound.
Yeah.
But the statistics in Kenya, there are 2.5 million people who are using tobacco. And it is estimated that there are 6,000 Kenyans every year who are dying of this use of this tobacco.
Okay.
And they brought it down, there are about 79 Kenyans, 79 men, and 37 women dying every week of this condition.
Okay.
So it is something I think that it must be dealt with. We have the laws, we have the Tobacco Control Act, we have even the Constitution talking about protecting our Kenyans from this condition.
Okay.
So that's my contribution, and I think we should do something about this.
All right. I'll come back for the next 3 questions, but let me get a quick response from Dorcas here. Is poverty a leading factor when it comes to tobacco usage? Very briefly. And then those who he says, Abu says that when you're in school, they say, "Mi siwezi shika kitu kama sija smoke." Is that a fact? Does that high make you any more active, or is this just one of the things that Robert was talking about earlier on? Very briefly, so that we get the next set of questions.
Thank you very much. It's true, 8 million people die every year globally from tobacco consumption, and in Kenya about 6,000 a year. And this 8 million is expected to rise to 10 million annually by 2030, with 80% of these deaths occurring in low and middle income countries, Kenya being one of them, and the highest rise will be in Africa. The recently disseminated global atlas called Tobacco Atlas shows that there is a global decline in tobacco consumption, but there is a rise in Africa in low and middle income countries.
So poverty is a factor.
Yes. Most people who smoke actually are poor people because they do not know the harmfulness of tobacco products. Okay. They don't access information, and also that usually that many people who are poor, they used to buy in stick.
Okay.
Yeah. And they are not able to access health information, so they don't know the effect and they don't know where to find the health that they need.
All right.
So it is associated to the majority of the users are poor, but also consumption of tobacco leads to poverty because it makes you spend your money when you don't get any profit out of it, and it also makes you sick. You spend more money in hospital, and the money you spend. On average, a person spends 1,200 for tobacco products in a household. And given the people living under $1 a day, that is a lot of money.
So it's a vicious circle.
It's a vicious circle.
Okay. Let me bring in Robert.
Also for the farmers is the same.
Robert, when you hear the statements like what he's saying, that people say, "Mi kama sija smoke, siwezi shika kitu kwa class," what comes to your mind? Is this the same statements you used to hear back in your days, that you need to smoke to get a girlfriend, things like that?
Let me say, what contributes to such thinking is peer pressure, nothing else. Because you want to fit in, and those people you find there before you, they introduce you to their club. You must show them that you're also man enough. You can join them by doing whatever they are doing. So in the process, you find yourself smoking cigarettes or using the drug that they are using. The other thing I wanted to emphasize about tobacco is any form of tobacco use. If you are a smoker out there, or you are a user out there, always remember you are working with cancer in your pocket, cancer of the lungs, cancer of the mouth, cancer of the larynx, like this one of mine, very many types of cancers, and the only solution is to stop using those products. I also forgot to say that it is not only the pain that you will go through after using these products, not only the physical pain, also the financial pain, because like in my case, I ended up spending a lot of money because of this disease, and this is money that I could have done something better for my family, or could have uplifted my standards, because we are talking of over 2 million shillings. How many Kenyans can afford that kind of money? Because I had to reach out to my friends to contribute for my upkeep, my financial obligations. Therefore, as one of the persons there said, tobacco, putting it in Kiswahili, ni hasara tupu, hasara tupu, hasara tupu. It has no benefits to any one of us. Therefore, I would advise those who are using it to abstain forthwith, because what is awaiting them is very painful.
And if you don't mind sharing, you said it's very expensive. How much is that gadget that you're using?
This gadget comes from only 2 countries in the world, that is US and Germany. It costs 120,000. and I use a battery which also costs about 1,000, between 1,000 and 1,500. So when you look at the whole scenario of tobacco, is loss.
Yeah.
Because how many Kenyans can afford this machine?
Yeah.
And we have so many people who are losing their voice boxes because of using tobacco.
Yeah.
Actually, I was just joking with Dorcas and telling her that when we are in this room, all of you are talking using mid-air, while somebody like me, anytime I talk, I must pay for it. So, for anybody who is using tobacco out there, you need to know that it is a dangerous product.
Yeah.
And it is a very bad drug because of its addiction.
Yeah.
I went through so much. Then I thought the best way to reach out to many people is by writing a book.
Yeah.
And I wrote a book talking about my experiences with the cancer of the larynx, what I went through, what my family went through, and it is not easy.
Yeah.
But mine now is to tell people to stop using tobacco products. That is my campaign.
Okay.
And I have campaigned for a long time against tobacco use.
All right.
For more than 10 years now.
Okay.
And I think I'm not stopping anywhere anytime soon.
All right.
I will continue campaigning against tobacco.
All right. That's a very powerful statement when you say that people speak for free, but for you, every single time you have to utter a word, you have to pay for it. And that is the effect of tobacco. Let's hear 3 more comments back there. I'm running out of time here, so we'll just be very brief. Yes, go ahead.
Okay, I'm Brian Collins, a student at St. Paul's University. And I want to echo what Jesse has said here about the usage of tobacco in campuses. So I want to challenge the government. At least have forums in the universities. We are just talking here, and after here, nothing will happen to the other side. So kindly come to these universities, sensitize students, tell them the effects of tobacco.
Okay.
Tusiachie tu hapa. Let's bring the message to the campuses and also to the colleges. Thank you.
All right, pass the microphone back there. Let's get really quick comments or questions. Yes, go ahead.
I'm Okinda Vincent, and I'll be brief. I only have a comment. And looking at the situation, how it is, I've heard Madam saying about curbing making sure the smoking cigarette does not go all the way to the coming generation.
Yeah.
My comment was, why does the respective authorities take the mandates so that this cigarette may not be sold to people and carry them back at home? I sell for you the cigarette here, you use it from here, and then you leave free-handed so that you are not carrying or rather exposing it to the young people or rather young children back at home so that they may know that this is a useful drug that can be used maybe to stimulate the brain.
Okay.
So I could or rather I could beg the respective authorities to look at it.
All right. Pass the microphone back. They'll come to you as the final remarks. Yes.
My name is Bernadette Chebet, and my main concern is to those youth who have parents and siblings that use the tobacco. How can we best tell them that this thing is bad, because maybe they cannot really listen to us and maybe hear us because we are more close to them? How well can we really present this message to them? That's my concern.
Any other person with a burning comment over here, very briefly, as we wind up on this? Yes.
Thank you, Trevor. My name is Mike Langata, student of International Relations in Mount Kenya University. I'm a very proud Kenyan to be involved in this wonderful discussion, and I actually agree it is the best discussion so that we move forward in our nation, so that we save life. And on 31st May, as the students, we are going to rally behind this campaign to demystify and ensure that this issue of tobacco and this compound is thoroughly understood. Those companies making profit at the expense of the lives of Kenyan should actually be exposed. As a son of this wonderful nation, I want to confess that this stuff or this compound is actually causing mayhem. I've heard the figures you have read, and it is actually a loss compared to the gains that is being said. The question we should be asking ourselves is, Trevor, Why are people taking this tobacco? There are those who believe it is a sense of rebellion. There are also those who believe that taking tobacco, it is an opportunity for them to show independence. And Trevor, as we are fighting this tobacco, we should be able to remember those who are taking tobacco for them to relieve stress. And this stress is caused because of the lack of food, the lack of rent, and the lack of many other things. We should also remember how the government is going to help the tobacco farmers to convert them to have sustainable crops so that we solve the issue of food shortage in our country. And as a student of international relations, Trevor, I believe it is through negotiations and dialogue that we are going to influence those who are taking this tobacco and influence them positively. And it is only through negotiations and dialogue we are going to influence them.
All right, let me hear from this lady as we wind up on that part, and then I'll come to you for brief comments. Yes.
Okay, my name is Dr. Mashua Irene. I'm a consultant psychiatrist. I work at Life Bridge Psychiatric Hospital and Rehabilitation Center. So as you have heard, we're getting so many cases of mental disorders. We're getting so many cases of psychotic disorders. We're getting cases of people dying by suicide. We're getting cases of depression, either directly or indirectly. And let's not take it simply. Just because there are other cases of non-communicable diseases, the mental disorders are coming up. We are losing our young children. We are getting so many cases of unrest in schools. And even when you send them to do tests, there's no single test that tests for tobacco, unfortunately. So you send back to school and tell them there's no product you have found. And the teacher is very sure that this person is using substances. So even the chewable tobacco is coming up. So we are losing cases of children conduct disorders. We are losing them by suicide. And the cases that we saw, even a young child at the age of 9 dying by suicide. So this is a case, it is a crisis, and I'm seeing so many cases of mental disorders in the psychiatric hospital. As many as 80% of patients that I see either are using tobacco or have used tobacco at their point in their lives. So it is a case that we need to take up, and as a Ministry of Health, let us take it up and assist them.
Okay, Robert, very briefly.
Okay, thank you. I'm just want to comment on some questions arised when there are people or the audience were trying to talk about the control of tobacco in early childhood education, or these people who are going to schools. As I said before, that I'm a farmer at the same time. I'm a farmer service center working with the Farm to Market Alliance, which is being conducted by CGA under the World Food Program. And this project is being funded or by World Health Organization. We have gone as far as connecting with the schools which are registered with the 4K Club. And as per now, as I talk, in Migori County, we are having around 10 schools whom are demonstrating this tobacco control through growing of iron beans in their school. So I hope finally, or in the next 2 to 4 years coming, these children will take this message to their parents, and they will automatically shift from tobacco to other alternative lifestyles.
All right, got it. You had the microphone first. It would be unfair to close without you giving a comment, and yet you spoke. Go ahead. You had the microphone first. Yes.
Okay. Thank you so much, Trevor. I'm Wayne from KCA University. I would like to conclude by just giving out this comment, especially to the Ministry of Health, the government, and all the regulatory bodies. Let's create awareness, especially to the youths. If it affects someone of 7 years, then you can imagine the students who are in campus. So my conclusion will just be a comment that let's create more awareness to the youth. Thank you.
Yes, go ahead, very briefly.
Sheila Raymond. I work in the slums of Nairobi, and I work with young people. And I wanted to confirm to Nancy and Dorcas that one stick is being sold in all the shops in the slums. So you can go even now and buy one stick of a cigarette. And then my question is to Nancy. You had mentioned that the law is being reviewed. Is it already in Parliament? Is it something that the members of Parliament are thinking about starting it? And was there public participation? Because this is where the problem is. Members of the public do not know about these things. There's a law, but they have no idea that you're not supposed to sell one cigarette or you're not supposed to sell to a child, because this is still happening in the country, and especially in the slums, which is really, I think, not a good thing. So I think more awareness should be done, as it was suggested by my other guests. But as that is done, what is the ministry doing to ensure that people are aware, they know that cigarette is a risk? You know, we've seen photos of alcoholic people, and people know when you drink alcohol, this is what happens. We haven't seen any about cigarettes. And this is, I think, the reason why people feel cigarettes are not that bad after all. Because the pictures are hidden in boxes. Boxes are then hidden in drawers. So no one knows. So what are we doing to ensure that many people know about these things and the effects of nicotine?
Nancy, I'll start with you to summarize in just 1 minute. There's been a question on having forums at the university to create awareness. There's someone suggesting people to smoke on the spot so that you don't go with it when it's sold to you. Then there's the issue of awareness as well to the people there. And then when this is said and done, what is the one message you want everyone to hear tonight? All that in 1 minute.
Okay, thank you very much. The minute is almost gone. But I agree with the person who has said we must raise awareness, 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 starting with the universities. The good news is that from tomorrow, we will be in 24 counties, raising awareness, a more sectoral approach with the administrators, with the county government, with the community health workers, and we are raising awareness about the law, about the effects of using tobacco, and then after a few weeks, 2 or 3 weeks, we will go to the rest of the counties. And so awareness is already in our plan. Number 2, the Constitution of Kenya guarantees the Bill of Rights, right to health and right to clean environment. And this is the bottom line, that we are stopping any use of tobacco so that Kenyans can enjoy what is promised in the Bill of Rights, the right to health and right to clean environment. The other thing I would like to say is that the universal health coverage, UHC, whenever someone steps into a hospital, we are encouraging, like what the medical doctor said, we are encouraging that they are asked the question, do you smoke, or do you live in a household where there is someone smoking? So that we start protecting the children from that. When a parent takes a child to hospital, coughing, 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 and a lot of respiratory issues, there should be an examination whether there is somebody who has been utilizing tobacco. The other thing I want to say is about what the psychiatrist in our minister said, that she has come across the rise of mental disorders. And when they examine in that hospital, what have you consumed? It seems like the person who has been stopped from killing themselves, or who has come with a mental disorder, psychosis, and others, has been consuming one of the tobacco products, the new ones, the old ones, or a combination. That is one reason we banned shisha, because the combination that is put in the shisha bottle brought in a lot of things. And so that rise of mental disorder needs to be examined. And I think the government is doing that. So we are working very closely with the Directorate of Mental Health so that we can see. And then we are moving in the government laboratories, whether they are in Camry or the government chemists and others. They are examining what are the contents of these products, and there should be a disclosure.
Okay. All right, your minute is up. Robert, what is the one thing you'd want people to hear from you? What are the lessons you want people to learn tonight? If there's one thing you want people to hear, what would it be?
Thank you, Trevor. Before I go to that, let me comment on what Dr. Catherine said about those people who go slums. We all need to know that smoking, cigarettes, or tobacco use is the gateway to all the other drugs. That is something that we all need to know. Anybody who goes to smoke bangi or drink alcohol, the first drug of choice is tobacco. So, if we can get rid of tobacco at that first stage, the better for all of us. Now, my punchline, we are commemorating the World No Tobacco Day on 31st. That is next week. I would want to send a message to anybody who is using tobacco products to underline the word no. When we say World No Tobacco Day, I want them out there, those who are using these products, to underline that word no, and always remember that the word no is a perimeter wall that will protect you from very many diseases, from financial losses. That is my punchline.
All right. All right, Dorcas?
Thank you very much. I would like to assure Kenyans that the government of Kenya is really taking many steps to protect the health of Kenyans and to promote the health of Kenyans through tobacco control. And just to inform the public and the audience here today is that the ministry has worked with the Ministry of Education to incorporate tobacco control messages into the curriculum of primary and secondary schools and even tertiary universities under the drug and substance use subjects. So it is there in the curriculum. Children are being taught, and children are big change agents, as the farmer Robert spoke also, that they use children to help encourage family members to quit growing tobacco. Yeah. So we have integrated this to education, and in the health sector we have also integrated it into the community health, in health promotion, and also the public health officers enforce the law, which is the Tobacco Control Act. And maybe we need to strengthen, to pull up our socks. Thank you for the feedback, and we are going to work together with the county governments to ensure that there is an allocation to facilitate them to see the need to allocate resources for enforcement at the county level. Okay. As we already have a very good law in place, we already have good policies, good guidelines, and we have integrated tobacco control into healthcare management or clinical guidelines and also community guidelines. All right. My message tonight is that the government has put in place those policies. Kenyans, please claim your smoke-free space. Yeah. Parents, please protect your children by claiming smoke-free spaces for them at home, in public places, and ensure that if you find anybody who is breaking the law, you can report to the nearest, you can raise awareness. Sometimes, even when you call to the owner of the premise, they should be able to evacuate the person and take the necessary measures, because the law already protects you. All right. And the government will continue to work with other agencies, with partners, and count on the public to support tobacco control. And there's no form of tobacco consumption that is safe or is better than the other. They are all harmful. All right, Nancy, I have to wind up, but you have a burning comment, very briefly.
Yes. I would like to call upon Kenyans, when boys are initiated, not to be given cigarettes. Okay. To be a man is not to consume tobacco product. Okay. Number two, when people are doing funerals and they are digging the grave, let the reward not be tobacco products. Okay. Let's stop this reward, because it is an initiation into consumption, into a very dangerous drug. All right. Tobacco kills. Tobacco is a very dangerous, and it's all derivatives. It's very dangerous product. All right. Let us stop consuming this and save ourselves the health of our bodies, the health of our children, the health of generations to come. All and Kenya will be a better place without tobacco use.
All right. Thank you so much for making time this evening. Nancy Gashoka, Chairperson, Tobacco Control Board, Dorcas Kiptui, Head Division of Tobacco Control at the Ministry of Health, Robert Mwangi, throat cancer survivor and also an author, and most important, thank you all for the valid comments that you made and the questions as well. That's where we leave it for now. My name is Trevor Mbiji. It's always a pleasure having you with us. This has been the Monday Report. 8 days with World No Tobacco Day to be marked. All we can do is give you the information. What you do with that information really is up to you. Good night.